We are back for our lightning talk. So just a quick note of introduction on this. These 4 lightning talks come from researchers here at the University of Minnesota, primarily those who are early in their research career. We have had those pre-recorded so that we could move without too much technical difficulty between them. So what I will do here is simply be the player of those videos. But what I wanted to highlight is that when we move to the next part of our event, which is the panel discussion, we will start the panel discussion with reactions from our panelists about aspects of these lightning talks. And so they are also things that can come up in our next discussion. Okay, so with that, the first talk comes from the Institute of Child Development, Meriah, DeJoseph, Kate, Carosella, and the NPSP mentors, the NextGen Psych Scholars Program.
Hi everyone, my name is Meriah DeJoseph, and I'm a 4th-year PhD student at UMN's Institute of Child Development. Today I'll be giving a brief overview of the NextGen Psych Scholars Program, which I created last year with Kate Carosella and a large group of psych PhD students. Before I get into the program, let me start with some of the motivations behind it. So psychologists are broadly concerned with understanding mental health and development, where such knowledge can be translated in ways that support a diverse array of individuals, especially individuals from marginalized or economically disadvantaged communities. However, to truly maintain integrity and the impact of this work, members from those communities should be involved in the research cycle, as shown here, from planning or determining which questions we ask, data collection and sharing, review, and dissemination. And this really requires building pipelines via community-based participatory research, mentoring first-gen college students, and championing diverse trainees to remove barriers to success in academia. And ensuring the voices of these communities and scholars from them are amplified will spur meaningful progress in the social sciences field. Yet, despite honest efforts, there's still tremendous room for growth in achieving truly diverse teams of students and faculty. Importantly, the US population is rapidly becoming more diverse. Yet as these 2021 data depicting racial ethnic breakdowns by psych programs show, students of color remain underrepresented in the psychological sciences. In addition, low-income first-gen college students are less likely to go on to earn graduate degrees, and there remains very little representation of disabled and LGBTQ+ students. Beyond graduate training, ensuring diversity at the faculty level is equally important. Yet certain gaps just seem to widen, in particular with even more faculty reported to be white. A recent paper further demonstrated the striking lack of representation of faculty from socioeconomically disadvantaged backgrounds, where the estimated median childhood household income among current faculty is over 23% higher than the general public, and faculty are 25 times more likely to have a parent with a PhD. So what's behind some of these longstanding diversity problems in psychology? The path towards a PhD, especially in psychology, is really intensive and includes a long list of milestones. For a first-gen college student or students with intersecting marginalized identities, navigating this path is especially challenging. And these barriers to success can range from a lack of financial or educational support, as students are unable to work for free as unpaid research assistants, and maybe lack professional networks from which to seek guidance. They might also experience additional psychological stressors, oftentimes from guilt over leaving families behind, or stress of taking care of family members while in school, or stress from experiences of racism or discrimination. Academia was also created to be highly exclusive, with many unspoken rules largely hidden to those outside of that world. And if a student from an underrepresented background does make it through the ivory tower gates and onto a PhD program, they may continue to struggle with the lack of financial resources and perhaps feel isolated without external sources of support after leaving their communities behind to pursue this path where there may be even less individuals like them in their new academic spaces. At the same time, the lived experiences of these students have provided them with immense sources of strength that can be leveraged and celebrated to foster a greater sense of belonging in academia. So one solution to dismantling these barriers is to create a safe, open, and supportive environment where trainees across multiple levels and backgrounds can lift one another up as we all navigate academia together, innovating and changing the culture of it from the ground up. And this is really the foundation and motivation behind NPSP. So NPSP is a year or possibly more long virtual trainee-led mentorship program for underrepresented undergrads and postdocs interested in applying to psychology PhD programs. And we have over 300 mentees for these aspiring PhD students and almost 200 grad/postdoc mentors from diverse backgrounds, pictured here with mentees on the left and mentors on the right. And NPSP is generously funded by the UMN Tri-Psych. And a unique feature of our program is that we pay UMN grad students as consultants to acknowledge their time and efforts. We've also been working to foster cross-program collaborations to pay additional mentors and get some help with growing the program. So you'll notice here that we recently partnered with Penn State, which has been really great. Collectively, the process of getting this funding showed me the surprising power of trainee voices and the immense receptiveness we got from Tri-Psych faculty. So I just want to take a quick moment to thank those faculty who really championed this program and advocated for us to get this funding. And here's our core NextGen team. I'm extremely grateful to the many PhD students pictured here, especially the co-director, Kate Carosella, and our lead mentors, who dedicated their time, perspectives, and content to the co-creation of the program. And just of note, while myself, Kate, and our PSU coordinator, Marissa, manage logistics of the program, we obviously have limitations with respect to the perspectives we can offer and varying degrees of privilege we have. And thus the program really relies on the voices and contributions of these lead mentors, as well as our additional mentors that make this program what it is. And the list of our mentors continues to grow. So with this large team, we're able to cultivate long-term support structures between current underrepresented psych PhD students and diverse undergrad or postbac mentees. And broadly, we seek to embrace and celebrate the unique journeys that have led current graduate students to pursue a PhD, with the hope that this might also inspire and empower the next generation of scholars while enhancing feelings of belonging in academia. To achieve these goals, we focus on mentorship, demystifying the hidden curriculum of academia, building community, and financial support and advocacy. For mentorship, mentor-mentee pairs are matched based on identity or program area preferences if available. Mentors also participate in a yearly training where we share best practices for mentoring in a socio-culturally responsible way. For programming related to the hidden curriculum, we have a large Google Drive with resources and example statements. We also use Slack to answer mentees' questions, and we hold monthly workshops on parts of the application and host small group statement and CV feedback sessions. Fostering community comes in the form of Slack channels for identity-based issues, self-care, and celebration. And my personal favorite is our NextGen Story series, where mentors and mentees representing a given identity will come together in a more intimate setting. Finally, we continue to work on securing sustainable funding for our UMN mentors and those outside of UMN. We're also working within our programs and other universities to cover application fee waivers for our mentees. At the end of year one, we sent out a survey to our scholars to get some outcome data and feedback for ways to improve the program. In the service of time, I'll just give you a few highlights. So of the mentees who applied to PhD programs, 78% received at least one interview, and 62% of those received at least one offer. We also saw some benefit back to our own programs. Specifically, 3 NextGen mentees got accepted to UMN's ICD program, and 1 decided to attend. I also want to highlight some of the more qualitative outcomes of the program from the voices of our mentees and mentors. So our Slack is private, but here are some public tweets. And one thing I'll just quickly point out here is that while a primary aim of NPSP is to support aspiring PhD students, this community is equally for our grad student or postdoc mentors, especially those from underrepresented backgrounds. And through the program, and especially our monthly NextGen Story series, grad students are celebrated for their unique, more human stories and perspectives that they might not feel they can talk about in a traditional academic space. So some tweets down here at the bottom highlight this. And this further fosters connection across trainee levels who may relate to those shared struggles and the strengths that they've acquired from them. And with that, I'll close with our mission and bring it back to why programs like ours are important for science. Of course, science, no matter how rigorous or transparent, inherently requires a scientist who brings a certain perspective and lived experience. Thus, cultivating diverse teams of scientists to tackle today's most pressing societal issues would improve the science by bringing a voice to marginalized communities through the scientists who have themselves grown up in those communities. And diversifying the next generation of psychologists will enhance the questions we ask, the methods we use to capture diverse lived experiences, and ensure that the conclusions we draw are really rooted in context and integrity. And this is what will collectively get us to a truly rigorous, transparent, reproducible, and honest science. And here are links with more information about the program, and feel free to reach out via email or Twitter with questions. I'd like to thank the organizers for this exciting symposium and the NextGen team again, and thank you all for your time and attention.
Okay, so our next lightning talk is from Vanessa Anyanso and Victoria Wee from the Department of Educational Psychology, COVID-19 Emotional Wellness Study.
Hello, my name is Vanessa Anyanso, and I am currently a third-year counseling psychology student here at the U, and I work with Dr. Richard Lee.
Hi, my name is Victoria Wee. I'm currently a second year in the Counseling Psychology Program, and I also work with Dr. Richard Lee.
And we both have spent a lot of time over the past 2 years working on the COVID-19 Emotional Wellness Survey with Dr. Lee, and we are so excited to be sharing this project with you, mainly focusing on the process that led to this project becoming what it is today. So this project originally began as a brief qualitative survey that was focused on how members of the University of Minnesota community were coping with social distancing. This first wave was partially funded by the Office for Equity and Diversity, and we'll talk about that a little more later. This first wave of the survey included questions asking about how the pandemic had affected their work or school performance, what steps they were taking to protect their mental health, how they felt social distancing was affecting them in their relationships, and any experiences of discrimination. After looking through these first round of responses, and also realizing that COVID was going to be around for a while, we decided to put out another wave of the study. And this second wave included many of the same questions from the first wave, and we also added in a few brief quantitative scales. After completing the second wave, we looked at the responses to inform the next survey's questions. And just as we were about to launch the third wave of our survey, George Floyd was killed in South Minneapolis, and we decided to include a few questions about that event as well.
So from us talking about the creation of these first 3 waves of data collection, You can see how we approached each wave of data collection. We were highly attuned to what our participants were sharing, as well as current events, and tried our best to incorporate items that touched on these concerns. After the third wave, we were intimidated by the amount of qualitative data we had, so we switched to fully quantitative scales for waves 4 and after. But our process hasn't changed. Although it is a shame that we weren't able to pre-register our study, the upside is that we were allowed to be very responsive and flexible in our survey development. Dr. Lee has presented preliminary results of this survey to various groups on campus, and he always makes sure to ask attendants if there's anything that they'd be interested in learning about, and he brings their suggestions back to us to consider for the next wave. So while this is an open science in the stereotypical sense, we are very open in the brainstorming stages for each wave.
So this slide here gives a broad overview of what our sample across the waves looks like. We have a sample that is almost equally divided amongst faculty, staff, graduate, and undergraduate students. And as you can see, about a third of our sample identifies as a person of color. And as I said earlier, the first wave of our study was partially funded by the Office for Equity and Diversity. So when we began recruitment, we looked up all the student groups for underrepresented students on campus, and we also reached out to the Community of Scholars Program and the Multicultural Center for Academic Excellence to better help us reach those undergraduate and graduate students. And something that I think makes our study unique is the inclusion of staff and faculty, as we really wanted to get a sense of how this was affecting the whole UMN community. We reached out to different staff and faculty groups first, before then reaching out to more general department chairs and managers. So we think our study is unique and diverse in two ways. First, with the inclusion of staff, because a lot of studies don't really tap into the staff population in the way that we have, and also our POC sample. Because even though a third may not seem like a lot, it took a lot of time, thought, and effort that went into trying to reach these populations, particularly staff.
So developing the study in real time amidst all of the uncertainty of the pandemic created the opportunity to get undergraduates deeply engaged with various aspects of the study. Students in Dr. Lee's Psychology Research Lab helped brainstorm items for the survey and also pilot them to detect potential survey errors. Dr. Lee created a summer research class that focused directly on this study. It also made for a great way to teach students about research methods and survey construction, especially because the topic was something that affected everyone. At the end of the semester, students used the surveys to formulate their own research questions. Some even chose to become more involved in the study as research assistants, doing qualitative coding, pursuing their own research questions for programs such as the McNair Scholars Program, and working on various projects related to the study. One such project is the Timeline Management Project.
So this timeline project is an exciting side of this project that we haven't really had the opportunity to talk about much. By the second wave of data collection, we realized that there was so much happening and so much new information coming out each day about the pandemic. And since our participants had a 2-week time period to complete the survey, it was possible that participants who completed a survey a week apart from each other could be answered in response to vastly different social contexts. So this project initially started as a way for us to have something to refer back to and easily get a sense of what was going on and the context that participants were completing their survey. We originally had just the COVID timeline that was focused on tracking developments in the pandemic, number of cases, shutdowns, vaccinations, reopenings, mask mandates, etc. And we also included news reports about anti-Asian hate crimes and tracked things relating to the events that unfolded after the death of George Floyd.
And however, as we all know by now, George Floyd's death, as local as it was, ended up sparking a wave of protests across the country and the world on a scale that I don't think we've seen in our lifetime. There was so much happening each day just with the protests here in the city, so we decided to create another timeline just to track those events. And unfortunately, as time went on, we heard about other deaths, such as Rashard Brooks, Ahmaud Arbery, Breonna Taylor, and protests and trials associated with each of them. So this timeline ended up evolving into a timeline where we kept track of racial events and the unrest, the other pandemic that we are currently experiencing.
And as I said, this project mainly began as a way to track these events so that we would have something to refer back to have some context when we analyze our data. However, we are also interested in finding out whether there are other ways that this kind of timeline and context data can be used.
So far, we've talked about the process of this study and how it's been a tool for undergraduate involvement in research. We also just wanted to take a moment here at the end to zoom out and talk about the other projects that have come out of this.
So for my first year project, I investigated how the death of George Floyd and the Minneapolis unrest impacted the mental health of participants, and whether interpersonal conflicts serve as a mediator, and if these relationships were different for participants of color. I found that people who reported more distress about these events reported worse mental health and sleep, and that individuals who reported conflict in their discussions about these events actually had better mental health outcomes, and that there were no racial differences between white and POC participants.
And for my first year project, I examined how vicarious racism, i.e. major events of racial violence, such as George Floyd's murder and the Atlanta spa shootings, and worries about discrimination affected mental health over time, and if this relationship was different for participants of color. I found that participants of color had greater discrimination worry than white participants, and discrimination worry may predict mental health around major events of racial violence, particularly for participants of color. Jay Tai, another graduate student in Dr. Lee's lab, examined whether individuals' perceptions of the seriousness of the COVID-19 pandemic predicted their mental health outcomes. They found that people who perceived the pandemic as more serious in wave 2 reported worse depressive and anxiety symptoms in wave 3. Because this is a longitudinal study, the results discussed in these 3 projects were all found even when holding the previous wave's depression and anxiety scores constant. Other projects mentioned before include the qualitative coding of responses in earlier waves, and this is completely spearheaded by 2 advanced undergraduate students, the timeline project, and further validation of the social connectedness scale, which is a scale that Dr. Lee had developed in the past.
So that's all we got. Thank you for attending our lightning talk. And if you'd like to reach out to either of us about the study, please feel free to send us an email, and our emails are listed right here on the slides. Thank you.
All right. So our third lightning talk is race and ethnicity data in the era of global migration. A change is in order, from Serin, Erayil in the Department of Medicine.
Good afternoon, everyone. My name is Serin Edwin Erayil. I'm an assistant professor in the Department of Medicine here at UMN. My talk is on race and ethnicity data in the era of global migration. I have no conflicts of interest to report. This talk is based on a paper that was published by my colleagues and I in the American Journal of Tropical Medicine and Hygiene this summer. Modern travel and migration have facilitated increasingly diverse populations across the world, especially in destination countries such as the United States, where at this point, refugees, immigrants, and migrants account for approximately 13.7% of all residents, which is about 45 million people. Disparities in health outcomes among these diverse groups has been increasingly understood to reflect social determinants of health and racism, and not just biological or cultural factors, as was historically taught. This calls for a re-evaluation of race and ethnicity data collection, especially in the setting of the current COVID-19 pandemic. Having more actionable data that is more reflective of the population has become crucial. As an example, which of the hundreds of primary spoken language materials need to be prioritized for vaccination-related messaging. Race data has been collected by the US government since the first census. And current categories for classifying individuals by race and ethnicity are based on a 1978 Office of Management and Budget Directive called the Race and Ethnic Standards for Federal Statistics and Administrative Reporting. While this standardization has proved crucial in revealing disparities in morbidity, mortality, healthcare access, and utilization across different groups, it has failed to evolve over the last 40 years and has become insufficient in capturing the US as it is now. As an example, people of Middle Eastern or North African heritage are under current categories considered white, when a lot of the disparities they face are akin to that of people of color. The term Black, in another example, combines American descendants of slavery across the United States and the Caribbean, as well as immigrants from African countries, even though these are very distinct populations from a healthcare perspective. So we propose a routine collection of 2 additional variables: primary or preferred language and country of birth or origin. Now, this may seem like a rather simple, straightforward, kind of obvious addition. So I'm going to use the next few slides to demonstrate the feasibility as well as significance of the addition of these variables. So I like to call these my health partners stories. For those of you who are unfamiliar, Health Partners is a healthcare system in the Midwest that caters to over 1 million people. And they've used these 2 categories in their data collection. And in the next few slides, we'll go through some interesting information this edition has revealed. So the first example is about hepatitis B screening. Hepatitis B is an infection that disproportionately affects foreign-born individuals, and the CDC has recommended screening such individuals for this infection. However, only less than 30% of qualified individuals actually get screened. So Health Partners used country of birth or origin information to develop a global health wizard that essentially led to healthcare providers getting an alert when they use the electronic medical record during an encounter with such a patient, which led to more screening, identifying hidden infection, and then they were able to refer these patients for care, preventing end-stage liver disease and cancer. In the second example, they evaluated disparities in up-to-date mammogram screens among white women versus Black women. And they noticed a 10.5% disparity gap. And then they disaggregated these data as white women versus US-born Black women versus foreign-born Black women, and noticed that the disparity gap between white women and foreign-born Black women was actually much higher at 21.4%. And this enabled them to utilize more targeted interventions like educational materials in Somali and Liberian languages, and arranging for transportation to screening facilities, which led to reducing the gap significantly. And they were also able to use this information to advocate for on-site mammography for a clinic serving African-born women. In a third example, having information on language enabled them to calculate elective stay for inpatient mental health admissions for those who spoke English as a primary language versus those who had limited English proficiency, and found length of stay to be almost 1 full day longer for patients with LEP, which is really significant from a healthcare cost perspective. So this allowed them to advocate for interpreters to be available for these patients during their mental health care, and that led to reduction in the disparity and a decrease in cost of care. So while these examples prove the feasibilities and significance of the addition of these variables, this model is not without its challenges. So certainly would require buy-ins from public health agencies, healthcare systems and providers, would require standardization, deciding where to use this data collection method, training for staff, messaging for patients, managing the complexities of the large number of languages and countries in the world. And then of course, the threat of misuse of data that, as healthcare providers, we all need to stand against. And additionally, we also recognize that this model will also not accurately identify all groups of people. For instance, if someone's Portuguese speaking in Brazil and Black, they will not be accurately captured by this model as well. So continued refinement of data collection methods is what we are advocating for. In conclusion, refining race and ethnicity data collection practices could improve our ability to respond to public health crises, help us be more equitable, cost-effective, and impactful in reducing health disparities. Thank you all for listening. I have included my contact information. Please feel free to reach out if you have questions. I would like to thank my co-authors, Kumi Smith, Sige Gabrislase, Pat Walker, Erin Mann, Sarita Wilkins, and Bo Stauffer. Thanks.
Okay, and our final lightning talk, reproducibility in interaction analysis, stepped analysis across 3 similar contexts. Megan Goka, which I probably butchered the name, apologies about that, from the Department of Educational Psychology.
Hello, my name is Megan Goeke, and I'm a PhD student in the Department of Educational Psychology, Psychological Foundations of Education track. Today, I'm going to be talking about reproducibility in interaction analysis, a stepped analysis process across 3 similar environments. As a learning scientist, I explore questions of how people learn in authentic learning environments, meaning I try to look at learning as it happens without my intervention. One of the primary tools in a learning scientist toolkit is the video camera. Recording allows researchers to examine the minutiae of interactions, little moments that fly by too fast for direct observation. An underlying epistemological stance of the IA method is reliance on evidence internal to the case, meaning claims are based on the publicly available features of the interaction and inherently situated in that particular context. Full studies using IA can take the form of single case analysis, mapping across interactions with the same interlocutors, quantification using coding schemes, and more recently, longitudinal studies of interactions involving a focal participant. In traditional IA, validity is achieved through the search for disconfirming cases, continual improvement of findings or interaction conjectures, and the convergent interpretations of multiple researchers viewing the same data corpus. Of course, and not surprisingly, as a situated qualitative method, a host of critiques arise about generalizability of findings and replicability of methods. In particular, conceptual replication of interaction analysis studies can be difficult because of lack of clarity concerning case production, case selection, and coding schemes in original publications. When using IA to understand educational settings with the goal of improvement, generalizability of findings becomes paramount to avoid implementing changes based off of uncommon interactions or unique situative factors of a single environment. Thus, we're left with a core question. How can learning sciences both honor the situative uniqueness of an unfolding learning moment and address the reproducibility concerns raised by open science? I argue that one solution lies in going back to IA's methodological roots. Historically, IA developed out of conversation analysis, a sociological tradition interested in the orderliness of human conversations. In addressing questions about why not use quantitative analysis in conversation analysis, Emanuel Shegloff, one of the founders of conversation analysis, explained, the natural organization of the domain of events being studied will have had some practice understood by co-participants, and ensuing actions built on that understanding will have constituted a next bit of interactional reality on the unfolding cusp of interactional time. And no number of other episodes that develop differently will undo the fact that these cases went the way it did. What Shegloff is saying here is that every single case, when we are studying what's internally evident from it, does not matter what happens in other cases, because what happened in this one did. We can look at single cases just for understanding single cases. Shegloff then goes on to say, in examining large amounts of data, we are studying multiples or aggregates of single instances. Quantitative analysis is, in this sense, not an alternative to single case analysis, but rather is built on its back. Here, Shegloff is pointing out that, in particular with CA, while you need to show that whatever you're claiming is valid in that individual case, it's when you build up the same claim across cases, this built on the back of the individual case, that strong findings come about. And that is no different from what many people consider quantitative analysis. So turning back to interaction analysis, I wonder, by making the process of moving from few to many cases, from exploratory to confirmatory analysis, by making that more intentional and transparent, can we improve generalizability claims and potentially conceptually replicate an analysis with interaction analysis? My own research focuses on how families learn together in informal makerspaces. Specifically, I've been interested recently on how maker agency is supported or constrained by the makerspace design and interactions with others in the space, focusing on the moments where makers announce what they are making as a key spot for agency expression. For this study, I developed an intentional stepped analysis looking across 3 different makerspaces. The cardboard-focused makerspace you see here that opened in 2021, an earlier version of this makerspace where video was collected in 2016, and an entirely separate art-focused makerspace where video was collected recently. Phase 1 of my stepped analysis is a traditional exploratory IA analysis, looking at public goal announcements in a single makerspace, that 2016 cardboard makerspace, and employing IA's standard approach to rigor and reproducibility. I transcribed a subset of clips, pulling for a breadth of the phenomenon, these public goal announcements, collaboratively analyzed with other members of my research lab, and built initial preliminary interaction conjectures. This first analysis allowed me to develop clear case inclusion criteria and findings in the form of those interaction conjectures. As a second phase, I intentionally froze these criteria and conjectures and applied them to all examples of public goal announcements in that 2016 makerspace. This allowed me to check that my initial claims were consistent across families in this makerspace and really captured the breadth of what was going on in that one site. Next, I am currently applying these frozen procedures to videos from the 2 additional makerspaces. Importantly, these additional makerspaces serve different demographic communities than the 2016 makerspace, and they both involved very different design decisions. This final step is a confirmatory check on the findings from the initial analysis, and it allows for new insights to be developed, attending to variation across participants and educational design in the makerspace. Here I'm trying to combine two visions of rigor: the continual improvement of interaction conjectures through disconfirming cases and convergent interpretation that claim to validity that undergirds all interaction analysis studies, with another vision of rigor, the explicit testing of these frozen conjectures, a process that gets closer to replication and reproducibility than purely staying in small scale exploratory analysis alone can do. And hopefully it'll strengthen the generalizability claim of these IE findings. Thank you, and I'm excited to hear your thoughts.